Poetry Initiative.
Welcome to this episode. Today, we're diving into a deeply complex and troubling healthcare story, one that starts with the patient seeking elective cervical spine surgery to improve quality of life, but ends up revealing serious systemic failures.
Yeah, it's a story that really challenges the assumptions many of us have about managed care networks and institutional accountability. The patient wasn't an activist or a litigant at the start, just someone trying to get better through a routine procedure called ACDF.
Right, anterior cervical discectomy and fusion. It's a pretty standard surgery for certain spine issues, and in this case, the patient had multiple consultations and imaging before deciding to go ahead. The expectation was straightforward. Buy insurance, use in-network providers, Humana coverage, Methodist facilities, UT physicians, and receive competent, ethical care.
Exactly. The patient's letter to Dr. Cigaroa in March 2025 put it plainly. The goal was to improve the quality of my life through what should have been a routine elective exercise and wellness. That phrase really sets the tone for the whole story.
But what happened instead was anything but routine. The surgery took place in mid-October 2024 at Texan Methodist, performed by the UT Physicians Spine Center team. Instead of a clean procedure, the patient ended up with two severe complications, what they called two unexpected bonuses, a 5-centimeter esophageal perforation and a viral infection in the spine.
That's wild. Those complications turned the post-op period into a nightmare. ICU care, multiple surgeries, transfers between facilities, and a discharge almost 3 weeks later. It's a stark contrast to the hospital's public messaging about making lives better and delivering life-changing care.
Yeah, the irony is brutal. The patient's narrative flips that language on its head. Life-changing care, but in the worst possible way. And what's important here is that the patient wasn't asking for perfection. They were asking for basic human decency, ethical, moral, and honorable treatment. That's the core expectation behind every consent form and insurance contract.
And the patient's first instinct wasn't retaliation. Instead, they tried to resolve things reasonably, documented in what they called the Reasonable Expectations Letter. That letter laid out 3 main asks: reimbursement of out-of-pocket expenses, future care support tailored to the injury, and compensation for pain, suffering, and lost days.
Right. The reimbursement was about $3,750, covering copays and imaging. Then, for future care, the patient requested things like acupuncture, up to 20 visits a year, physical therapy, speech therapy, manual therapy, pulmonary therapy as needed, and even 2 radio ablations over a year or 2. All with requests for fee waivers where appropriate.
And then there was the compensation for intangible harms, $15,000 for pain and suffering, plus over $32,000 for Medicare benefit days lost, totaling just over $51,000. It's a measured, thoughtful approach, not an excessive demand.
What struck me was the patient's explicit intent to bring leadership into the loop and to be treated as they would want a family member treated. They weren't trying to throw anyone under the bus, but sought healing and closure.
Yet, despite that, the system's response was fragmented and defensive. Insurance denials came even while the patient was incapacitated. Subrogation efforts followed, records were scattered, and governance structures failed to step in effectively.
It's a textbook example of how the machinery of managed care and hospital governance can prioritize financial and bureaucratic processes over patient welfare. The patient trusted the network, the insurance, the hospital names, expecting transparency and accountability. Instead, they got delay, confusion, and financial recapture efforts.
That really highlights the gap between institutional branding, mission statements, ethics, compassion, and the lived reality of patients. The moral core of the story is summed up in the patient's own words. Doing the right thing means stepping up and acknowledging responsibility and accepting the consequences.
And doing the right thing is never the wrong thing. Those lines cut through all the legal jargon and corporate speak. They remind us that at the heart of healthcare is a simple question. When the system harms a patient who relied on it, will it step up?
Sadly, in this case, the answer was no. The failure to respond honorably transformed a private grievance into a public account of systemic failure. It's no longer just about one surgery gone wrong. It's about how network promises, surgical processes, Insurance decisions and governance structures can collectively fail the very people they're supposed to protect.
The closing line from the patient's March 2025 letter is especially poignant. They said they would rather sing the praises of the spine center than recount a $1.1 million debacle of a surgery gone wrong. That's both a warning and a missed opportunity for institutional self-reflection.
It really invites us to think about the ethical and governance challenges in modern healthcare. How do we ensure that catastrophic outcomes don't get buried under corporate defensiveness? How do we align financial incentives with patient-centered care?
And it's not just about money or legal liability. It's about transparency, timely communication, and honoring the basic human expectations embedded in every interaction: consent, insurance, treatment.
The phrase "two unexpected bonuses" is such a powerful rhetorical device. It encapsulates the tragic irony of the case. What should have been a routine surgery turned into a life-altering injury, with the system failing at every turn to make it right.
Yeah, and for healthcare professionals, administrators, and insurers, this story is a cautionary tale. It shows what happens when institutional actions don't match their ethical commitments.
So, to sum up, this case is a stark reminder that trust in managed care networks is fragile. It demands that institutions do more than just brand themselves with lofty missions. They have to live those values, especially when things go wrong.
Absolutely, and for those of us who work in or study healthcare systems, it's a call to keep pushing for governance structures that prioritize patient welfare over spreadsheets.
Well said. Thanks for joining us for this deep dive. Hopefully this story sparks some important conversations about ethics, accountability, and the real meaning of care.
Thanks for listening. We'll catch you next time.